Hi, my name is Julie. It's February 28th, 2011, and it's also International Rare Disease Day. I'd like to talk to you about rare diseases, including a little bit about my own rare disease, essential thrombocythemia. Essential thrombocythemia is the myeloproliferative neoplasm, or MPN, which is a little bit easier to say. MPNs include chronic myeloid leukemia, polycythemia vera, and essential thrombocythemia. Those are all chronic blood leukemias that affect different blood cells, and they all have the potential to develop later into a fourth MPN called myelofibrosis, which involves the scarring of the bone marrow. My rare disease, essential thrombocythemia, can affect a patient in a few different ways. First, our bodies naturally shut off platelet production when our platelet levels reach a safe range. Production is shut down until more platelets are needed. With essential thrombocythemia, there's no longer that shut-off switch, and platelets continue to be produced beyond a safe level. Another way that essential thrombocythemia can affect a patient is that it puts them at high risk for clotting events, like strokes, heart attacks, even microclots that can accumulate in the smaller blood vessels of the hands and feet and impair circulation. Essential thrombocythemia also puts a patient at high risk for bleeding events like nosebleeds, internal bleeding, aneurysms, and hemorrhaging during surgeries. Standard treatments for essential thrombocythemia can include a daily aspirin regimen or oral or self-injectable chemotherapies. More extreme treatments can involve bone marrow transplants or mechanically filtering the platelets from the blood. That's all a very basic explanation of my rare disease. But what I really want to talk to you about in this video is rare diseases in general and our responsibility as a patient. There isn't really a set definition of what a rare disease is, but here in the United States it's generally accepted that a rare disease is one that affects less than 200,000 patients. Now that may seem like a big number, but over 200,000 new cases of breast cancer were diagnosed in just the United States in just last year. Now, the obvious drawback to a rare disease is that it doesn't get the attention that other diseases get. And it also means that our general doctors aren't as educated in these diseases. This doesn't make them bad doctors, because we can't really expect a single doctor to know everything. That's why we have specialists, but that's also where we come in as patients. There's a lot of discussion about being active in our care after a diagnosis, but I think it needs to begin sooner than that. We need to be more proactive in monitoring our own health. Do you know what your counts are? A lot of people know what their cholesterol count is, or they know what their last blood pressure reading was, because those issues get more attention. But do you know what your red blood cell count is? Do you know what your platelet count is? When your doctor does a routine CBC or a blood panel, ask them to go over the results with you. Ask them if each result is within a normal range, and if it isn't, ask them what could be causing the abnormal reading. Do you see your doctor on a regular basis, or do you only see them when you're sick? We need to see our doctors when we're healthy, because they need to be able to establish a baseline for us, and they need to be able to make sure that our baseline is a healthy one. This is also the time to bring up any symptoms that we may be having. Rare diseases don't always show themselves in a blood panel, but they may show themselves in symptoms that we're experiencing. Again, ask your doctor if these symptoms are normal or what could be causing them. I neglected to tell my doctor about the first symptoms that I was having of my rare disease, which were fatigue and extreme itching, for a few years. And it just so happened that my doctor that I had at that time was also overlooking an elevated platelet count. Now, if I had communicated with him better about my symptoms, and if I had asked about this abnormal platelet count, I may have been diagnosed sooner. Now, I got lucky. The delay in my diagnosis didn't result in any major issues for me, but I was lucky. Many people don't know that they have a rare disease until it's too late. Don't wait until after you have a stroke to find out that your platelet count was high. Don't wait until after you're diagnosed with a rare disease to find out that better communication could have led to an earlier diagnosis, which at the very least could have meant less pain and discomfort and frustration. Just don't wait. Don't let your family find out after your death that you had a rare disease that could have been treated. Rare diseases don't have to mean a disadvantage in our diagnosis and our care. The more aware we are as patients, the more aware our general doctors will be of these diseases and how to diagnose them and who to refer us to for our treatment. Personally, I think these diseases aren't as rare as we think. I think a lot of people have these diseases undiagnosed, which isn't just a risk for them, but the more diagnosis that these diseases receive, the more attention they'll get. And that will result in more funding for research, possibly earlier diagnosis, better medications, better treatments, and a better prognosis for people who are diagnosed.